mothers and daughters, sisters and cousins, aunts and nieces, grandmothers and granddaughters, friends and colleagues. Hundreds of thousands of precious women losing their lives to breast cancer every year. Breast cancer. It can be a killer, but it is one of the most curable of cancers if detected early. So let us get familiar with breast cancer, because when we are armed with knowledge, we can save many more lives. To begin with, what are the risk factors for breast cancer? Age. Peak incidence in the West is between 50 and 64 years, and in India it is 5 to 7 years earlier. A long menstrual life, early menarche before the age of 12, late menopause after the age of 54, nulliparity, and the first child after the age of 30. No breastfeeding. Increased levels of or prolonged exposure to hormones, both estrogens and progestogens, through the prolonged use of oral contraceptives with higher estrogen content and or hormone replacement therapy. Family history. Breast cancer in a first degree or second degree relative. Genetic mutations, BRCA1 and BRCA2, which can increase a woman's lifetime risk of developing the cancer from 45 to 85%. But known genetic factors account for only 5 to 10% of all breast cancers. Other important factors are obesity, physical inactivity, high alcohol intake, a high-fat diet, exposure to ionizing radiation, and high socioeconomic status. But the truth is, most women who develop breast cancer have none of these risk factors. Next, epidemiology. Let's start with the global picture. Across the world, over 1 million new breast cancer cases are reported each year, leading to over 400,000 deaths. It is the most frequently diagnosed cancer in women worldwide, 23% of all cancers. In affluent societies, the lifetime risk is 1 in 8 or 9. Now let's come home to India. In 2012, around 145,000 cases of breast cancer were diagnosed and over 70,000 deaths reported. It is the commonest cancer among women, having surpassed cancer of the cervix uteri. The incidence rate is 21.9 to 28.3 per 100,000 in urban areas and only 8.6 per 100,000 in rural areas. The lifetime risk is 1 in 25, but WHO predicts that by 2020, it will match the Western rate of 1 in 8. Locally advanced breast cancer constitutes more than 50 to 70% of patients presenting for treatment, which means that Indian women get diagnosed at a later stage, raising the mortality rate. Early detection is crucial to reduce the mortality rate. In fact, in developing countries, we see a higher disease burden despite lower incidence. According to WHO's Globocan, for the year 2012, an estimated 70,218 women died of breast cancer in India, more than any other country in the world. Second was China, with 47,984 deaths. Third was the USA, with 43,909 deaths. Notice the difference in the numbers. Which means in India, late diagnosis leads to advanced cancer, leads to higher number of deaths. Early detection is crucial. So what are the methods of early detection in asymptomatic women? Monthly breast self-exam. Clinical exam by a doctor or nurse. Mammography. In India, the first point of contact for a woman's breast exam is the gynecologist or female family physician. These doctors must stay aware and sensitive to the issue of early detection. Teach your patients breast self-examination. Observing the breasts. First, stand in front of a mirror so that you can see at least up to your neck and down to your waist. Now, keeping your hands on your hips, look at the size and shape of each breast. If you notice any changes, you need to consult a doctor. But do remember that it is not unusual for one breast to be larger than the other. Look also for any puckering, dimpling or any other changes in your skin. Now look at your nipples. Is there any change in the position of either nipple? Also, look for any retraction of the nipples or discharge from them. If you have large breasts, lift them up slightly to examine them underneath. Again, look for any changes in the skin here. Now raise your arms over your head and look for similar skin and nipple changes. Continue the examination with your hands clasped behind your neck, pressing them forward and tightening your chest muscles. Finally, place your hands on your hips, press down and in, and look again for any changes in your nipples and skin. Feeling the breasts. Lie down and place a folded towel under your shoulder on the side you're going to examine first. Raise your arm under which you have placed the towel. You may find it most comfortable to place your hand under your head. The area you will examine includes not only your breast, but also the area up to your collarbone, as well as below your breast, across to the breastbone, and over to your armpit. Using the pads of your first 3 fingers, begin to examine your breast using a series of small circular motions, each about the size of a rupee coin. You should use 3 levels of pressure: light, medium, and firm. This way you can feel the different layers of breast tissue. Using this technique, trace a series of vertical strips moving from the collarbone to below the breast and back up again in zigzags until you cover the entire area. You may also use a technique where you trace a series of concentric circles towards your nipple, or a method where you cover the area through a series of wedges. Use the pattern that you're most comfortable with. But the most important thing is to cover the entire area of the breast. Also, squeeze the nipple gently and see if there is any discharge. If there is any discharge, please see your doctor. Now repeat the entire process on your other side by placing the folded towel under the opposite shoulder. Perform a clinical exam of your patients once a year. Add a reminder in your patient records. Clinical examination by the physician must be done properly, methodically, so as not to miss an early cancer. Women must be undressed from neck to the waist. Examining a patient's breasts over her clothes should never be done. Inspection and looking for changes should be done in the sitting position. Axillary and clavicular nodes are also palpated in the sitting position. Palpating for changes in the breast is done in the supine position with arms above the head. When you examine your patient's breasts, keep in mind the signs and symptoms. Any change in the shape of the breast, any skin discoloration, any lump or thickening in the breast or underarm, or any changes in the shape of the nipple like puckering, retraction, or nipple discharge. Any change from the normal look and feel of the breast must be investigated. Please do not ignore even the smallest departure from the normal. Remember the screening protocol. Breast self-examination once a month after the age of 20. Clinical examination once a year after the age of 30. Mammogram once in 2 years after the age of 40. Mammogram once a year after the age of 50. Breast cancer can develop in any woman at any age.
as a gynecologist, we must make it a point to keep a focus on the breast when we are treating our patients. The incidence, especially among urban women, is rising alarmingly, and more younger women are being diagnosed with the disease. Whether a patient has come to us for conception, delivery, contraception, or menopausal symptoms, we have to palpate the breasts to check for any abnormalities. I must mention here that patients that present with abnormal uterine bleeding associated with endometrial hyperplasia or have chronic uninterrupted high estrogen levels like polycystic ovarian disease with infertility are at a higher risk of breast cancer. So we must advise them to go for screening as well as teach them breast self-examination. Essentially, we cannot ignore any breast abnormality because if a tumor is palpable, it is already in stage 2. Every gynecologist must stay alert for the signs of breast cancer. Don't you think we owe it to our patients?
With breast cancer emerging as one of the fastest growing cancers, if there's even the slightest concern about a patient having any sign or symptom of breast cancer, the next step is obviously a mammogram. When conducted and interpreted properly, a mammogram can pick up even the smallest of lesions and even something called microcalcification, which is an indicator of early sign of breast cancer confined to the milk ducts. This can even be seen in the breast, which is dense on mammogram. So it is only in the younger woman with the dense breast and a woman who is an older woman with a dense breast where you recommend an ultrasound. So what are the guidelines for the imaging protocols in symptomatic women? Ultrasound for women below the age of 30, mammogram and ultrasound for women between the ages of 30 and 50, and possibly only a mammogram for those over the ages of 50, combined with ultrasound if the breast is dense. One is often asked about the role of MRI. Now the first thing is, an MRI is indicated if there is a diagnostic dilemma. That means the mammogram and ultrasound are equivocal. In that case, an MRI is definitely indicated. It would also be recommended in women below the age of 30. It could be used also in women who have 2 first-degree relatives with breast cancer, because you could miss a small lesion. If a person has a risk of more than 80%, a genetic risk, in that case, definitely an MRI, a genetic counseling, and also a breast specialist consult. There's something called tomosynthesis, and one is often asked what this new kid on the block is. Tomosynthesis is a mammogram combined with sectional images and is now emerging as an interesting and a very good imaging modality.
In case we find any suspicious lesion, we go in for FNAC or core biopsy, as the case may be. Ultrasound guidance, being cost effective and convenient, remains the first choice for intervention. Ideally, mammography remains the gold standard for screening the world over, as it picks up early stage cancer. However, in India, due to financial constraints, clinical breast examination by the attending physician or gynecologist is the next best choice. There is a general misconception that frequent mammography leads to breast cancer. One is probably not aware that all of us are exposed to natural background radiation present in the atmosphere equivalent to 4 mammographies in a year.